we're there to give them comfort, give them dignity, but also give the family a little bit of peace of mind that there's an extra set of eyes, a little bit of extra, just a little bit of extra.
Welcome to Better Together podcast, produced and directed by Our Hospice of South Central Indiana, a not-for-profit dedicated to making every moment count. We will share true stories about hospice, palliative, and personal care services that we provide in 22 counties all over South Central Indiana. I'm your host and president, Steph Cain. Well, in the studio today with me, I have three fantastic caregivers, and we have Loretta Lucas, Kristina Caplinger, and Ginger Sims. Welcome, ladies.
Thank you.
Thank you. Welcome. So Loretta started with Our Hospice as a registered home health aide in 1999. Is that right?
Yes.
Nearly 27 years of caring for patients. And now she works as a donor data specialist in the resource development department. And I have with us also Kristina Caplinger. She's been with Our Hospice for 6 years. Yeah. And she's been a home health aide in North Vernon and later serving our clients in Greensburg and the surrounding areas, where she continues to support patients and loved ones. And we also have Ginger Sims, who became a certified nursing assistant during her junior year of high school in 1989. Is that right?
That's correct.
And spent many years working in that role. And after her father was cared for by Our Hospice, Ginger moved by the kindness and support her family received. And she was so moved that just recently, last year, became a home health aide for us and wanted to give back in that way, making every moment count for patients and families. So thank you.
Yes.
All right. So let's get started. You know, for listeners who might not know, share with us, what does a home health aide do as part of the care team with Our Hospice?
We provide the patients with their personal hygiene care, helping with and assisting them with their baths or showers, shaving, changing the sheets on their beds, getting them cleaned up and ready for the day. We go into their homes. Also, we go into facilities.
Yeah, so wherever they call home. I think this is such personal and intimate work that you do, caring for someone, toileting, bathing, doing all of those personal things. You have to build trust and rapport up front, right? So Loretta, tell us a little bit about your experience.
When I started in 99, I was telling Ginger, it was pagers, no 911 system, so addresses were directions that were written on a sheet of paper that said, third mailbox on the right, green barn. I literally heated up water on the stove to give someone a bath. So,
yeah.
But you just do what you have to, and you come to them on their level and make them feel comfortable that you're there. You're not there intruding. You're not taking their space, and you're going to let them have their dignity.
Perfect. And what are some of the ways you build trust up front, you know, right when you meet someone for the first time?
I mean, you introduce yourself and let them know what you're doing, and you're there on their level to help them. And you just kind of talk to them and build a little relationship.
You know, the work is very, very personal. And so, you know, what are some of the small things that home health aides do that can make a real difference for patients?
Take a little extra time with them. You know, ask them if they need anything that you haven't done.
Try to make that personal connection. One little thing can make a difference on how comfortable they are with you.
What are some of your favorite things to talk about with the patients?
A lot of their past, what they've lived through, what they've seen. That's very interesting.
Patients like to talk about their kids, I feel like, too, their families and their grandkids. And so that's something easy to ask them about.
She's right. Families. Smallest picture can help you connect with someone and ask them a question that gets this conversation going.
You know, could you share how you work with the rest of our care teams?
We're the eyes and ears of the nurses, the chaplains, the social workers. We see we spend more time with them than anyone.
What would you say to a family member who might feel nervous about having a home health aide come into the home?
You know, sometimes for the families, not that they necessarily need a break, but they might need something to do. And so you can encourage the families to take a little break, and you've got this for them for that time that you're there.
Also, I feel like patients don't necessarily want their son or their daughter or someone like that to give them a bath. So when someone else is coming in that does this every day for a living, they feel a little bit more comfortable with us coming in and doing it, knowing that this is what we do all the time.
What do you wish more people understood about the role of home health aides and, the role that you play in hospice care?
Just that we're there to give them comfort, give them dignity, but also give the family a little bit of peace in mind that there's an extra set of eyes, a little bit of extra. Right. It means a lot to people just to have that little extra.
Also, I feel like with our home patients especially, the caregivers have never changed someone in bed or had to clean them up in bed. So us being able to go and show them the tips and tricks to kind of make it easier to take care of their loved one when we're not there to do it for them.
That's a really good point. It's learning and a bit of teaching. Any stories come to mind that for patient stories or that you want to share?
I have a patient that's 98 years old and she is Alzheimer's. But every time I go and give her a shower, she always says, "God bless you." She said, "You just make me feel better all over." And I've been seeing her for about, probably 3 or 4 years, and she has Alzheimer's. But when she sees me, she knows me, and she always tells me she loves my beautiful smile.
Oh, that's so good. That makes you feel wonderful, right?
Yes.
Yeah, so good. And, Loretta, you worked in our inpatient facility, our hospice center, for many years.
We had a young patient who had small children. She wanted to go home and see her children go to school for the first day. I worked nights, probably 10:30, 11 o'clock. She went home. Her husband was here on his Harley. We helped lift her on the back of the bike. They were safe. We helped lift her on the back of the bike. He tied her do-rag around her head, put his leather jacket on her. The moon was full, and they pulled out of the front with Simple Man playing. Sorry.
Their song.
Yeah. Yeah, and turned around, and they went down the street. There was not a noise, not a car on 17th Street, nothing. She got home to watch her kids go to school the next day and pass that night. She passed at home, but she got to see her kids go to school that next day, and that was her wish, and we made it happen.
That's our mission, is to make every moment count. And that's such a wonderful example.
I was going to say, I've been on both sides.
I've been on both sides.
I was going to say, my dad and my sister both passed away downstairs. So.
Okay. Now, were you also already working with hospice?
Both.
Yeah.
Yep.
How'd that make you feel as a hospice team member?
The support I got was amazing. And I knew that my dad, when he was here, and I knew that my sister, when she was here, that they were being taken care of. And I could go home and get just a little bit of rest. And that meant a lot.
And it's sometimes it will allow you to be the sister, right? And not the kid.
And I was allowed to step back. Other than shaving my dad, he loved all the girls downstairs, but he said they were not going to shave him. It was going to have to be me.
Okay, there's certain things. Yeah.
My father passed away with hospice too, and I had worked in facilities before, but really didn't know what all hospice did. And when they came in for him, when hospice came in for him and just kind of took care of him and listened to what he needed and wanted, and it was just a load off of my shoulders. My dad signed himself up for hospice.
Oh, he did? Okay.
Hospital.
Oh.
And so when I was there, he's like, "Hey, I signed myself up for hospice." And I'm like,
"Whoa, we don't want that." Yeah.
Oh, Dad. So, the family was split because nobody really knew that. But,
and they don't want to be the ones to say, "We're going to put you on hospice."
Correct.
Yeah.
So he did it all. He did it all in a matter of...
Well, my sister was already non-responsive. She had a massive heart attack and they didn't get her revived in time. So she was already not responsive. St. Francis was like, we'll just move her to our facility. No, I've worked here since my daughter was 16 months, my youngest, and she just turned 28 Tuesday. So when my sister was on service, she knew everybody here, from my dad, from dropping off. She used to work at Scooters, from dropping off something to eat for me every once in a while.
Yeah.
And she knew all the people I worked with. And I just told the nurses there, and I, of course, kind of helped facilitate getting her out of St. Francis back here. But yeah, I knew this is where she would want to be. And Lisa McCone was over Volunteers in Medicine, and she was the one that worked with my sister at Volunteers in Medicine, helping her get her meds. Lisa met us at the side door when my sister came in, and she made sure that she had all the meds she needed, and my sister was there to fast peacefully.
You'll always have that connection with Lisa. Yeah. This is Better Together, a podcast dedicated to making every moment count. Thank you for listening. Please like us and share on your social media channels. If you have a question and would like to learn more about a specific topic, you can find us at ourhospice.org or call 812-314-8083. Until next time, remember, life is short. We are better together, making every single moment count.